I do?
That's a challenge. Hello, this is Siddharth Dambar, Chicago Arthritis and Regenerative Medicine. Welcome to our Wednesday live stream. So, Krista, I think if you...
I just turned on my volume on my computer.
Yeah.
Did that work?
I can hear you.
Okay. All right. We'll use this. I use my Instagram volume.
Okay, good. If anyone hears like a reverb on any of the channels, please let us know. Like if you're hearing kind of a duplicate or echo, please let us know. We're currently live on IG, Facebook, YouTube, Twitter, and LinkedIn. So today's live stream, I am connecting with Ms. Krista Baumann, representative from the Arthritis Foundation of Illinois. And we are kind of answering questions that people have and chit-chatting. By the way, Krista, is it Arthritis Foundation of Illinois, Arthritis Foundation of Chicago, Arthritis Foundation? Like, how does that work?
So we're Arthritis Foundation of Illinois local chapter. So, yes.
So Arthritis Foundation of Illinois local chapter. So there's other chapters in Illinois.
So we're the Illinois chapter. So each there's various chapters in other states. So we kind of sum up Illinois. Right.
How are things at the Arthritis Foundation? I know, I remember a few years ago, I think we'd had this conversation that the Arthritis Foundation based out of California was dramatically more intense than the one here in Illinois in terms of raising effort and their just intensity overall. How are things here nowadays?
So I think the Arthritis Foundation has been doing a lot of great things, trying to get connected with more people in the community. So they have a lot of great resources that we can chat about. I don't know if you want me to do that now or later, but they have some great resources on their website. And obviously with the pandemic, we are still trying to do some events, but virtually, and just trying to reach more of the community.
Nice, very good. Well, so we're trying to answer questions that people have about the arthritis and tendonitis. We have a list of questions here already, but if people have other questions, by all means, kind of shoot them on any of the chats. We're trying to follow them, I think. And well, let's start. So go for it, Krista.
Okay. So I have a few questions for you today. And the first one, being today is Veterans Day, I thought we would start there. So 1 in 3 veterans have arthritis compared to 1 in 4 adults having arthritis. And osteoarthritis is the number 3 reason that's behind injury and PTSD that active duty personnel retire early. So do you see an increase in this population in your practice? Any thoughts on these statistics?
Yeah, it's interesting. Obviously, this being Veterans Day, obviously, number one, a lot of appreciation to people who have sacrificed their lives, their mental livelihood, just everything, their bodies for our freedom and security. And it's interesting. When I started as a intern at Northwestern, my first rotation was actually at the VA hospital. And I'm definitely hearing an echo, by the way. I think somebody suggested, Krista, that if one of us is not speaking, we should try to turn off the mic until we take turns turning our mics on and off.
Oh, okay. Because I'm using my Instagram volume and I have everything turned off on my computer. At least I thought. How do I turn off my mic? I'm going to play with this.
Okay. So just kind of getting back to what we were talking about. Absolutely. You definitely see higher rates of arthritis, tendonitis, musculoskeletal issues in veterans. And part of that is because certainly the nature of that kind of work and responsibility does lead to a lot of demand on the body and leads to a lot of chronic injuries and chronic pain issues. And certainly also because There have been a lot of veterans who have aged over time, and the nature of aging and having prior injuries is that it does lead to more osteoarthritis. So 100%, these folks do have higher rates of osteoarthritis, have higher rates of tendonitis, back pain, all those kind of issues. And the way that you address them realistically is going to be the same way you address it for anyone else in the population, meaning number one, figure out, is their issue more inflammation related or is it more instability related? The difference is that if you have significant inflammation in a joint, there's a number of things you have to look for, like why is there inflammation there? On the other hand, if it's more instability, that's what leads to more wear and tear arthritis. And instability and degenerative issues are treated very differently. So from a diagnostic standpoint and an understanding standpoint, the way that you approach that is going to be the same. But certainly for veterans, you definitely have much higher rates of osteoarthritis, and that's certainly stuff that we can help out with.
Any feedback on if that echoes better? I muted myself for a minute there on my computer.
I think it's working. I think we're good.
Okay. All right. So next topic. So what are your thoughts on alternative treatment such as like massage, acupuncture, physical therapy, other ways kind of to help with pain? When do you recommend these treatments?
Yeah, great question. I think it's multi-layered. Number one is obviously first and foremost, have an understanding of what the problem is that's causing your pain. So if you have, let's say, knee arthritis, right? I mean, you should maximize everything you can do on your own conservatively. And so if that includes things such as physical therapy, exercises, but also massage, acupuncture, 100% you should do that. Keep in mind that when you look at something like pain, a lot of it is very subjective. And anything you can do to help manage that on your own without actually taking on more risk, including medication, surgery, is dramatically better. So 100% right way to first approach things: massage, acupuncture, and physical therapy. I think some caveats there would be, if you have a lot of inflammation, sometimes that has to be calmed down before you can get to more things like physical therapy. Acupuncture can help with that. Massage, if done properly, can help with that as well. But I think as long-term adjuncts or ways to treat pain, I think they're fantastic just because of how low risk they are. And working with a good provider or a person who's educated and knowledgeable and experienced can make a big difference for sure.
Now, physical therapy obviously is usually something you can get covered by insurance. Do you know like anything with like acupuncture or massage? Is that ever anything that someone might be able to get through their insurance?
My understanding is that most routine stuff like that, massage and acupuncture, is not frequently covered by insurance. There may be some insurances that are willing to cover it. I know physical therapy will sometimes do dry needling. That's not exactly acupuncture, it's different, but it's sort of in the same line as well. So some of it may be covered, some of it is not. But unfortunately, what people don't fully understand is that health insurance is not really, it doesn't function in the way that it's supposed to. Like, it's not really made to treat your health. It's essentially a financial middleman that sort of takes and absorbs some of the risk from you. And when you think of it that way, a lot of the things that can help with pain are frequently not covered by insurance, because while it makes a lot of sense from a healthcare standpoint, from a insurance standpoint, it doesn't fit into their model of care. But I think from a value standpoint, in terms of being able to help people, it's still a no-brainer in terms of being able to help people.
So continuing with the topic of pain, chronic pain obviously is a daily struggle for a lot of people who have arthritis. So any additional recommendations that you have when medication is just not providing enough relief?
Yeah, for sure. So again, first and foremost, why is there still pain, right? Is there pain because let's say you have a rheumatoid arthritis patient where they're on medication for inflammation. Some things are better, but they have some residual pain. Well, is that residual pain present because they still have inflammation, in which case their treatment needs to be altered? Is that inflammation or is that pain still present because they have wear and tear arthritis and the medication that they're on is not going to make a difference from a pain standpoint? Or is there pain present because, they have some kind of chronic damage in that joint, tendon, fascial layer that needs to be treated differently as well. So number one, first and foremost, figuring out why is there still pain. And number two then is maximize all those conservative things that we were just talking about: massage, acupuncture, physical therapy. Personally, I recommend maximizing a lot of over-the-counter supplements as well, whether that's glucosamine chondroitin, omega-3, curcumin, all things that have been shown to help with chronic arthritic-related pain. And then lastly, if that's not enough, then escalate beyond that. So as an example, let's say somebody has a chronic back issue from wear and tear arthritis, and that's not getting better with conservative options. Then consider some injection options. Always, when you consider escalating treatment, make sure that you're pursuing treatments that are low risk, that make sense from a long-term standpoint, that can then still provide value long-term as well. So I think if you take it in a stepwise approach, why is there still an issue? What have you tried that's conservative? And then progressively escalating as required, you can make a big difference for people in that case as well.
And obviously it's also important, so I'm a part of the arthritis community, myself having arthritis. So, obviously it's important to stay in communication with providers so they understand. I think some people might, I have this daily pain and tend to, maybe deal with it, and then not sure exactly when, that's when you need to communicate with your providers to find out what the next steps are. Do I need to switch my medication? Do I need something different? But obviously that's huge, is to find a provider that you have that, rapport with.
Yeah, I think in that line, trust is everything in life, right? And so if there's a problem, you should feel comfortable speaking with your physician about, hey, listen, I'm still having a problem. What can we do about it? What's going on, and what do I do next? And if they're, number one, if you don't have that kind of connection, I mean, like, why not? Like that's literally our job as physicians, to provide that sort of assistance and ability to help in those kind of issues. That's what we're trained to do. That's what we're here to do. And then I think figuring out what else needs to be done based on conversation that involves, look, here's your options, and what makes sense to you as the individual that's living with that, and then what makes sense from a competence standpoint from the physician end in terms of what else I can help out with.
Yeah, and I think another thing too, I'm also a social worker, so what I do on a daily basis is helping people learn how to be an advocate for themselves. So I think that's really key too on the patient end, is to work on that, understand that, and then know how to reach out to your providers, because obviously we have to be able to share with you what we're going through so you can better help us. I know also in your practice you do some other treatments. Can you speak a little bit to that and how that might help with pain?
Yeah, I mean, as a clinical rheumatologist, right, I was originally trained mainly in treating inflammatory conditions like rheumatoid arthritis, lupus, ankylosing spondylitis, psoriatic arthritis. And that's great for that subset of individuals who have those conditions. We have very good protocols and ways to treat that. There's a much larger group of people who have things like osteoarthritis and tendonitis, chronic back pain. And the traditional approach to those kind of treatments is really pretty lousy. It's very much, hey, here's some pain meds, here's some limited kind of treatments, and let's just try to get through it. And until things really fall apart, until you need surgery. And I always thought that is a really lousy way to approach things professionally. Like, that's not very satisfying. It's not very good for individuals as well. And that led me into other types of therapeutics, including utilizing a person's own blood, platelets, bone marrow-derived stem cells to treat things like osteoarthritis and tendonitis. And what I like about that is, number one, these treatments are low risk. Number two, you can really specifically treat some of those conditions that are not very well treated right now. And number three, I think it's professionally satisfying to have options for those kind of conditions that have not had very good options in the past. So my general approach as someone who focuses on non-surgical management of musculoskeletal conditions is, our goal is to get you back to a high quality life. I think what I find is that when people come in, they're not generally saying, hey, my knee hurts, that's why I'm here. They're there because, hey, my knee hurts, and I can no longer do XYZ. And our goal as a physician, certainly for me, is how do we improve things so that we can help for you to recapture part of that future so you can continue to do those things that are important to you. And whether that's utilizing treatments that are coming from your own body and cells, whether that's using medications that are meant to treat the source of the problem. Something else that I'm starting to get into is how else can functional medicine help? How can we actually treat things on a nutritional and exercise level so that we can maybe stop things at a source of what's causing it as well? Like as a physician, you have to be looking at all those kind of things to kind of continue to offer value to people when they still need help.
Any other foods or supplements? I know you touched on this briefly, but anything else that's helpful in reducing inflammation?
Yeah, a couple thoughts for sure. So from a supplement standpoint, there's a ton of things out there. The three things that I think are generally at least fairly well proven and that offer value are glucosamine chondroitin, omega-3, curcumin from turmeric. I think those are all good low-risk ways. There's actually pretty good data on all of those in terms of offering pain relief and reducing inflammation. So I think those are all good first-line options. Nutrition is an interesting one because what the recommendations I can give for one person might differ for another person. Genetically, if you come from background XYZ, where people have been eating a particular diet for thousands of years, that's different than someone who's coming from a dramatically different environment. As an example, if you are an Inuit, an Eskimo, right? If you're an Inuit and your people have grown up eating, seafood and whale blubber for hundreds, if not thousands of years, that's dramatically different than someone who comes from a group of people that have been eating vegetarian for thousands of years. And so it's hard to say that there's cookie cutter, hey, this is the one thing that you need to do, and from a nutritional standpoint, will not make a difference. I think definitely in the world that we live in, a more plant-based approach makes sense because the nature of how meat is processed and how it's consumed in terms of quantity. I think more plant-based approach certainly makes sense for most people in a Western and certainly American diet. I think we all eat way too much in terms of refined sugars. I think that's another no-brainer to try to minimize as well. And I think if you're able to do what's called an elimination diet, which means that you start by cutting out a lot of foods and then you slowly start to add them back in, I think that can make a big difference as well to figure out what's good for you or not. You hear a lot of cookie cutter approaches, things like, well, avoid dairy. Maybe some people should. Maybe that's not necessary for other people. So I think from a nutritional standpoint, there's some good guidelines in terms of more plant-based stuff and minimizing refined sugars, but I think everything else is very much a individualized kind of approach in terms of what actually works for that person.
Do you ever refer anyone to see like a nutritionist?
Yeah, great question. I do. The challenge is finding, I think on the inflammatory arthritis side, the challenge is finding nutritionists that really get like what we want them to do. That from an inflammatory arthritis standpoint, the things that we want nutritionists to think about are, number one, how do you reduce inflammation now? Absolutely. But the other part of it is also, we know that there's significant heart disease risks in our autoimmune patients. And so they need to be thinking about that as well. And so there's really multiple levels to it, but I really, really like the idea of adding nutrition as a component because I think that'll make a big difference long-term. By the way, I see a question on Facebook about somebody asking about very specifically Achilles tendonitis, and they happen to have RA. So Achilles tendonitis, which is essentially tendonitis of the tendon that inserts at the bottom of the heel, is it really depends on why you have that tendonitis. So I can tell you when I have patients that have something like rheumatoid arthritis or ankylosing spondylitis, the first question I have is that tendonitis that you have right now due to active inflammation, or is it because the tendon's been chronically injured over time? And so a really quick and easy way to do that is, or ankylosing spondylitis or RA, is to do a diagnostic ultrasound. Your rheumatologist or physician should be, if they're not able to do it, they can order it. But you basically look at the tendon and does the tendon have signs of inflammation, or does the tendon just have signs of chronic wear or tear to the Achilles tendon? So if there's active inflammation, then that may be a sign that your overall inflammatory arthritis is not controlled, in which case altering your medication regimen may be required to actually help to control that. On the other hand, if the inflammation is controlled, but what you have is more significant chronic tendon changes that are not going to be amenable to more medication, then first and foremost, you need to do the right kind of physical therapy called tendon. If it's not enough, then the treatment I would recommend is a treatment called platelet-rich plasma, where you're utilizing your own blood and platelets, injecting that specifically into the areas of the tendon that have been injured chronically over time to help strengthen the tendon and to help actually heal that tendon injury as well. I hope that answers that question.
All right. My last question that I have, unless anyone else who's listening has questions, let us know. But with the holidays approaching and COVID numbers increasing and people trying to, figure out their plans with family and friends, any new recommendations?
It's such a challenging question, honestly, because there's public health concerns, there's individual health concerns. I even on a clinic level, like we have to give guidance to the folks that work here as well. It's challenging because we know numbers are going to be going up, and we know that numbers are going up because of not just because people are avoiding large events for the most part, but they're going up also because people are still collecting together in smaller groups of people. I think realistically, if you're able to avoid traveling over the next few months, I think that's better, realistically. I know that's hard, and I know that the holidays are generally one of those things people would say, well, isn't that worthwhile living for? Like, why are we kind of isolating if we can't live? But I think it's a challenge right now because here in Illinois, there's some new guidelines that have come out in the last day where it's now being recommended that any state that has a higher rate of COVID than Illinois, that if you travel there and come back, you need to quarantine for 2 weeks. That's a pretty aggressive recommendation, but that's because the state and the city are recognizing that people are going to be traveling and that they're going to be rising numbers. What's really interesting is I think there's some organizations that get that and some that don't. My daughter's school, and she's been in school for the fall so far, her school has been able to manage that, which has been quite extraordinary. But they decided when they queried parents, what were they doing for the holidays? They realized that people were traveling regardless of what the guidelines were. And they decided they're just shutting it down and going remote for the next couple of months after Thanksgiving, because they realized that people were going to make decisions that they wanted to make. I think if you're making your own individual decisions, you have to decide what's best. I can tell you for my own family that we're really limiting our exposure. And my suggestion would be that that the public health authorities, their current guidance of really limiting what they're doing in terms of quarantining when you come back from travel. It's aggressive here in Illinois, but I think it's the right thing because we know numbers are going to continue to go up, and I think that's being smart.
Anything on like the healthcare end as far as like your practice? I know the hospital I work in, we still do telehealth when possible. We're still obviously doing surgeries that are needed, but have you heard anything that, things that might become more restrictive like they were before in elective?
Yeah, it's a challenge because I think the feeling of what was going on in this country with COVID in March and April, I think there was a certain amount of panic, which is why they really shut down all the elective surgeries and medical stuff. And part of that was they wanted to secure supplies, PPE, all that kind of stuff for the more acute cases. So that may still happen realistically if numbers spike in the next couple of months. But the flip side is hospitals are pretty darn strong as a lobbying group. And I think they're going to push back against banning elective surgeries unless it's the most extreme kind of situation. I think realistically, as an individual, I think the way that you'd want to approach it is, does the facility that you're going to, are they being thoughtful about how they're restricting people, or are they just business as usual? If they're business as usual, That's not the right way to do it. They should not be guided based on their business model. They should be guided based on what's right for individuals and patient care. And if they are, then they should be really pushing for telehealth first and foremost. And for treatments that still need to be done, you can still do them safely, electively. Just you have to take all those other kind of precautions. I can tell you that when I hear from colleagues at hospitals and larger facilities, are they really screening people properly? Their staff, their nurses, their physicians? I don't know. I honestly don't know. But I think part of that is the situation is relatively overwhelming in terms of how do you screen, how do you check on everyone that is exposed to COVID patients. But I think if your facility is really predominantly doing telehealth, I think you can still go in for elective procedures because they're obviously taking the right kind of precautions.
Those are all my questions. Did anyone else add anything on Facebook or anything?
I don't see any other questions, but I would
either.
Yeah. I would say I hope everyone's having a really safe and good fall. We've had incredibly good, unseasonably warm weather until yesterday when we had sort of a mini tornado or hurricane here in Chicago, and it's starting to get cold again. But Krista, I appreciate the discussion. It's always fun to talk, and it's always great to take questions from folks. Tell us more about some of the resources that the Arthritis Foundation has, not only in general, but certainly around this time as well.
Yes. So if you have not checked out the Arthritis Foundation main website, you can visit arthritis.org. You're going to find a lot of great resources on there, upcoming events such as the Jingle Bell Run. So that's obviously going to be virtual. It's our 5K event. It's the weekend of December 11th. So check that out. You can still sign up. You're also going to find information on our online community, our Connect groups, which is our support group. So obviously things are being done virtually right now, but they do have in-person meetings, you know, when the pandemic is not happening. There's also a podcast, so the Live Yes podcast. If you've not heard of that, you can find information about the podcast. We do have a helpline. It's staffed by licensed clinical social workers. So you can connect online through that, but you also can call the hotline. So I'll plug that number. It's 800-283-7800. And then, you know, lastly, the Arthritis Foundation has their Insight survey. Please, if you have arthritis, get on there and take that assessment. It takes about 10 to 15 minutes. It's very quick. And it really helps the Arthritis Foundation gather that data and know how to better help the arthritis community. So they'll ask you, you know, various questions just about like your daily your pain, get just your daily activities. So that information will allow for better resources and know how the Arthritis Foundation can help you. So they have an adult version that they've had for a little bit, but they recently released one for the JA community. So it's geared towards parents of JA patients ages 5 to 17. So yeah, connect with us on Facebook, Instagram, visit our website, sign up for events. And if you're interested in volunteering, we have a, you know, virtual event coming up in early December where you can find out more.
Wonderful. Well, thank you everyone for your time. And until our next live stream, I hope everyone has a good day and live well. Bye-bye.